let's talk about periodontal conversions. I know we have lots of patients.
Yeah.
I know, right? And I'll just start in the front and then I'll let you guys go. I know for me, the most frustrating thing is when a patient needs to go into perio and the insurance company says, no, put them in prophies or alternating prophies and perio. And we go to the hygienist and there's this whole, how do we talk to the patient about it? So tell us more about this and what you guys think.
So perio conversions can be a challenging conversation to have. And the reason they're challenging is because there's so many different sources of why we have to have them. So they might be brought into our conversation in the practice because we just started working with a consultant. And so now we're talking about converting patients to periodontal patients in the sense of practice growth, which always feels uncomfortable because then you're talking about how are you selling to your patients is what it feels like. So even when we know that the patient has the need for treatment, it still feels like we're recommending something that is going to be production-based or based off of profit. And then there are a lot of other situations too.
Yeah, I mean, you have the consultant who comes in who says, okay, you need to do this. But for the majority of us, we all kind of know where perio is supposed to be. ADA a while ago had released that there should be 30% or more of adults have periodontal disease. And I think this is when a lot of us started to look at our numbers, and our doctors and office managers probably started to look at the numbers. And this is where those perio conversion conversations have been coming up more and more for us, where we're going, ooh, okay, I guess maybe we haven't really converted patients, and why haven't we converted patients? And then we have those situations where somebody is alternating with the periodontist and us, and we're doing an adult prophy, they're doing a perio maintenance, and we're going, ooh, I think we're doing this only because of insurance, not because this is actually the treatment that we should be providing. And then that really uncomfortable conversation then comes up, right? I mean, we've had the uncomfortable situations even where you're doing an adult prophy on a patient for a while, you find that hidden piece of calculus, and then whoop, there's that 6mm pocket. And you're like, oh, okay. And it's a me problem. And now how do I have the conversation with my patient too? So there's so many situations that we come up with in the practice that then corresponds to the, okay, now we need to convert this patient. And no matter what the reason is, it's a difficult conversation to have because you're taking what is to what could be and somehow trying not to say like we weren't doing the right thing or providing the right treatment. And we want our patients to have the right care. And how do we get them from here to there and do it tactfully? Yeah. And so we've come up with a technique that has been proven to be very successful and super easy for you to be able to have this conversation with your patients and break down the conversation into a super easy 3-step technique. We have a video with Laura that really dives deep into it, but let's give you some tips that you can use right off the bat, right? So what do we say to our patients?
Well, so the first things first, as Laura was saying, so when you have those like insurance barriers, it's making sure that you have all the documentation. So you've updated the perio charting for that day. You have whatever radiographs are necessary to show any levels of bone loss, to be able to discuss with insurance any inflammation that's present. And then using these 3 things. So being able to look at your patient, have the conversation to say, something has changed. What we're doing is no longer working and we need to do something different.